You may have asked yourself the question, what exactly is dementia? Is it a disease itself, and how is it different from Alzheimer's and other diseases that affect a person's memory? In today's video, we're going to discuss dementia and how doctors diagnose memory-related conditions. Hi everyone, and welcome to the channel. I'm Rob King from Valley Senior Advisors. We help seniors and their families find the best senior living options in the Phoenix area, and our services are 100% free. Today we're talking about dementia and how doctors diagnose memory conditions. Before we get started, we created a free resource called the Essential Arizona Assisted Living Guide. You can download it for free at valleysenior.com/assisted living guide or click the link in the description. Also, hit the subscribe button and the notification bell so you don't miss any of our future videos. Dementia is a broad term used to describe a group of symptoms associated with decline in memory, cognitive function, and the ability to perform everyday activities. It's not a specific disease, but rather a syndrome characterized by the impairment of multiple brain functions. There are several different diseases where dementia is a symptom. Alzheimer's disease is probably the most well-known. Diseases like Alzheimer's are neurodegenerative diseases and are characterized by specific biological changes in the brain, including the accumulation of abnormal protein deposits and the degeneration of nerve cells. There are other medical conditions that can cause dementia that are not caused by a neurodegenerative disease. It's important for doctors to look for other factors that may be leading to dementia symptoms. Some conditions can be addressed and treated and restore cognitive function. One of the first things doctors will do is review a patient's clinical history and perform an exam. They look at the patient's medical background and understand the onset and progression of symptoms. Next, they'll likely conduct blood tests to rule out medical conditions that can present dementia symptoms. Some of the common factors that contribute to symptoms are vitamin deficiencies, thyroid dysfunction, and infections. Vitamin B12 and folate are essential nutrients that play crucial roles in various bodily functions, including the health of the nervous system and brain. Deficiencies in these vitamins can lead to cognitive impairment, and blood tests can help to identify and address these nutritional deficiencies. Your thyroid produces and releases hormones that regulate metabolism and support the overall function of the nervous system. Disorders affecting the thyroid gland can impact the way the brain functions and lead to brain fog, fatigue, and slower mental processing. Doctors can measure thyroid hormone levels through a blood test to identify any dysfunction. Certain infections can affect the brain due to the inflammation that occurs when the body is fighting off the infection. The inflammation can lead to temporary cognitive impairment, altered behavior, and confusion. Blood tests can detect the presence of these infections so doctors can treat them. Once other conditions have been ruled out, doctors may want to administer a cognitive screening test. One of the widely used tests is the Mini Mental State Examination, or MMSE. It provides a quick snapshot of a person's cognitive function. There are various other cognitive screening tools, and each has a specific focus and application. A doctor may choose to perform a particular test depending on the patient's condition and the setting in which the test is conducted. The MMSE takes about 10 to 15 minutes to administer and focuses on orientation, memory, attention, language, and visuospatial skills. Testing someone's orientation includes questions about the current date, day of the week, and location, and helps to assess a person's awareness of their surroundings. Memory questions of the MMSE assess both short-term and long-term memory. For instance, it may involve the recall of a series of words or the ability to remember a short phrase. Testing a person's attention evaluates their capacity to focus. This may involve tasks such as counting backwards from a specific number or repeating a series of numbers in reverse order. Language skills are tested through tasks like naming common objects, repeating phrases, and following verbal and written commands. It provides insight into the person's ability to express themselves and comprehend language. And finally, the MMSE tests visuospatial skills. This may be tested by having the person copy a simple drawing. This provides insight into the individual's spatial perception and coordination. The MMSE is often used as a preliminary screening tool because it's brief and easy to administer. Depending on the results, the doctor may administer a more comprehensive neuropsychological assessment that will provide a more detailed understanding of an individual's cognitive profile. Even with the long-form tests, the results are not always definitive and may have some uncertainties. The next round of testing to provide more information would be brain imaging. It provides a detailed look at the structure and function of the brain. Two common types of imaging studies used are CT and MRI scans. CT scans involve the use of X-rays to create a detailed image of the brain. These images help doctors identify abnormalities and rule out other conditions such as tumors, areas of bleeding, or signs of a stroke that may cause dementia symptoms. MRI scans use powerful magnets and radio waves to generate detailed images of the brain's soft tissue. They provide better resolution images compared to CT scans and are effective in identifying smaller structural abnormalities. In addition to structural imaging, functional imaging techniques provide valuable insight into the brain's function and metabolism. Two functional imaging tests are PET scans and SPECT scans. While CT and MRI scans primarily offer structural information, PET and SPECT scans provide functional data, allowing doctors to assess the activity levels of various brain regions. PET scans involve the injection of a small amount of radioactive material into the body known as a tracer. This tracer accumulates in areas of the brain with higher activity. PET scans can reveal abnormalities in brain function, such as reduced glucose metabolism, which is associated with conditions like Alzheimer's disease. SPECT scans also use a radioactive tracer to assess blood flow and metabolic activity in the brain. They can help to identify areas with reduced blood flow, providing additional information about brain function. It's important to keep in mind that there is no single test that can currently diagnose neurodegenerative diseases like Alzheimer's with 100% accuracy. These diseases are complex and multifaceted, and there's no single biomarker or symptom that's specific to them. There's currently no cure for Alzheimer's or other neurodegenerative diseases, but there are a number of treatments that can help to manage the symptoms. It's important to see a doctor as early as possible when dementia symptoms arise and be proactive. Treatments can help to slow the progression of the disease and improve quality of life. If you have any questions about memory care and what senior housing options are available, give us a call and we'd be happy to help. If you got value from this video, give us a like and subscribe to the channel. You can also hit the notification bell to be notified of when we post new videos. Valley Senior Advisors is committed to helping you find the best senior living care in the Phoenix area, and our services are 100% free. If we can assist you or a loved one in any way, please give us a call. Thanks for watching, and until next time, take care and we'll see you in the next video.